Hi, my name is Olivia Latney, and this is the Career Research Project Part 6. The National Career Clusters Framework has identified 14 nationally recognized clusters that provide insight into career interests. In the first four parts of this project, we investigated the career of our choice and identified companies that align with our professional goals. My choice was human and healthcare services. I understand it to be a competitive field, so deciding to go in this direction was a big step for me. One of my biggest concerns being that I would have to start over entirely from scratch, which wouldn't be ideal given how much time I've contributed to marketing and sales. It's reassuring to learn that roles in this industry are strictly departmentalized, but increasingly accessible once you obtain the necessary certifications. Physicians in health information management are responsible for the release of information and connecting patients with their healthcare providers. As a worker in these facilities, you are accountable for the patients that you care for. Career qualifications include, but aren't limited to, a bachelor's or associate's in a related field, CMAA or AIT program certification, 2-year prior experience in document imaging and medical office settings, and strong time management, self motivated, and interpersonal relationship building skills are held to a high esteem. Most sources describe the line and staff positions in healthcare as interchangeable. While I am planning on obtaining my CMAA, I am also considering staff roles that coincide with my bachelor's degree in communications and my soon to be associate's degree in business administration. Human resource specialist jobs often require candidates to have both medical assistant and administrative experience. First State Residential Living, First State Orthopedics, and Christiana Care are local organizations that have listed available human resource roles. In March, I will be working towards Medical Administrative Assistant certification at DelTech. This program develops management skills in medical transcription and patient intake, and internship clinical experience is included. Application of medical terminology in ordinance with ethical office procedures will also be built on. I look forward to networking with healthcare professionals who can provide further insight into what would be helpful as I gain experience. In recent years, patient services have begun diverting sign ins to kiosks and portals that process patient information digitally. Further development of this system in clinical settings could lead to outsourcing, which has the potential to eliminate jobs. From all the information we gathered, we can conclude that healthcare is not nearly as intimidating as it's often perceived to be. Changes are happening all the time on the job market. Every company has a different set of expectations in how they want to be perceived by the public. In day in the life videos on YouTube, people in the field describe days typically starting as early as 5 a.m. Upholding patient confidentiality is also a top priority in these roles, which isn't easy when communicating across offices who work with patients directly in different times, in different areas, what have you. Advancements in technology have shaped how doctors treat patients, but there will never be one universal way to navigate treatment. Healthcare is an industry whose values are rooted in public trust. People are unique and should be respected in their health journey. In my research, I was surprised to learn how accessible this industry is when you make the effort. I now understand why it's important to gain line experience to understand medical procedures and terminology used in the profession. When you're responsible for a high volume of private information, it's comforting to know how to answer questions and who to go to for guidance. On interviews, they usually ask you, why do you want to work for our company? What about you would be beneficial to the role itself? My response to that being, because I'm the one you want to have in your corner. Despite coming from an entry level perspective, I think that I have the knowledge and experience to provide a fresh take in healthcare company goals and missions. I plan on pursuing a staff position where I can schedule appointments and manage patient records. My CMAA certification will open the door to many possibilities in the healthcare services. I am very excited to start this new career.